Hello again. This is another discussion on advanced care planning put on by AARP Maryland in partnership with the State Advisory Council on Quality Care at the End of Life and the Horizon Foundation. My name is Ted Meyerson, and I'm a volunteer with AARP Maryland. It's worth repeating. The pandemic has infected millions of people and is causing the death of 1,000 Americans every day. And it looks like COVID-19 isn't going away anytime soon. Careful as we may be, there's no way to assure that one of us won't be infected and become desperately ill and unable to communicate. Previous panels have spoken about how you can use an advanced directive to maintain control over your health care, even if the worst should happen. The panelists for this session are well qualified to talk about advanced directives and the law, how the advanced directive that is part of the Maryland Healthcare Decisions Act came to be, and the importance of an advanced directive to you, your family, your doctor, and the hospital or facility where you may live. Paul Ballard is an Assistant Attorney General who is counsel for health decisions policy for the Attorney General. He also advises the Office of Healthcare Quality, which is the agency which licenses and regulates all the healthcare programs and facilities in the state of Maryland. Alan Eason is the current chair of the State Advisory Council on Quality Care at the End of Life and is a retired Assistant Attorney General of Maryland. Alan travels the state as an instructor on the use of advanced directives and MOLST. MOLST stands for Medical Orders for Life-Sustaining Treatment, and we'll talk more about that in a little minute. Jane Markley is president of M. Jane Markley Consulting. She is a registered nurse, a member of the State Advisory Council on Quality Care of the End of Life, and an international speaker who works with individuals, families, organizations, ethics committees, and healthcare systems to help them understand the importance of advanced care planning for themselves, their loved ones, and their members. She has served as chairman of a hospital ethics committee and provided educational programs on healthcare ethics and patient advocacy. Currently, she is an assistant professor of psychiatry at the Uniformed Services University of Health Services. Wow, that was hard to get through. You guys have so many things behind your name. Let's start with Alan. Alan, you're chair of the State Advisory Council on Quality Care at the End of Life. Tell us a little bit about what that is and what they're currently doing that our listeners might want to know about.
Okay. Thank you, Ted. The State Advisory Council on Quality Care of Life is a Maryland entity that was created in December 2002, and it is a body of people who have, under the law that created it, certain positions in state government, but then there are also people who have been appointed to fill different positions, and so it's a neat, wide variety of people. I think, and Paul could correct me, there might be 21 members or so, and the idea of, or the purpose behind the council is to study the impact of statutes, Maryland laws, regulations, and public policies on providing care at the end of life, care to the dying at end of life, in end of life situations. And so the council monitors trends in the provision of care to patients with fatal illnesses and participates in public and professional educational efforts concerning the care of dying. And these things, of course, as Ted said earlier, those are even more, quote, real with what we're facing as a culture and a society during the COVID-19. Another function under Maryland law for the council is to provide advice, and that's the advisory council, to the Maryland General Assembly, the Maryland Legislature, the Maryland Office of the Attorney General, the Department of Aging, the Department of Health, on matters that are related to the provision of care at the end of life. The council meets periodically, I believe, and Paul can correct me. It's supposed to meet, I think, 3 times a year, but periodically, and comes together, and members of these different backgrounds, mostly health related, raise different issues of concern and that are important to focus on. And as Jane and I noted with regard to our last meeting, the one of the things that popped up was palliative care, which is an important aspect of possibilities for people facing end of life situations.
Paul, how did the council get involved with the advance directive? And then at the end of that, would you introduce MOLST? Because I mentioned MOLST, and a lot of people don't know what that is. So will you?
Sure, I'd be happy to. The current advance directive form that the state uses, and it's an optional form, you don't have to use it, but it's available at the Attorney General's office. You can go to the Attorney General's website and find that advance directive at marylandattorneygeneral.gov. That is an optional statutory form, and it was well thought out, and the legislature approved it. It is a revision of a prior statutory form that was in existence before. And in 2006, it was revised, and the council supported the Attorney General's efforts in revising it. And the idea of the current form is to clarify a lot of things, to make it easier for people to understand and to address a lot of the issues that were somewhat unclear before that. So, for instance, it allows you to determine how much flexibility you want to give your loved one. Let's say if you want to trust them to make decisions for you and not bind them completely to your living will if you want. Or you can say, in alternative to that, I do want to bind them completely in my instructions. So it gives a little more guidance that way. So there are many different changes it made. And the council was part of supporting that process and giving feedback, incorporating comments. So the present form is partly in response to some of the council's work. So the council is around to provide a diverse group of viewpoints, because we have a lot of different types of persons with expertise who give their feedback, and it's a very good group. So the present advance directive form is identical to the 2006 version that was developed. And again, it is available at the Attorney General's website. And we also are very willing, if you call us, to mail you a copy of the statutory advance directive. Again, it's optional. You can use other forms. There are other forms out there. 5 Wishes comes to mind, but the Attorney General's office has that form. Now, the MOLST form stands for the Medical Orders for Life-Sustaining Treatment. It's a form. It's a standard form. And it's issued by your physician or your nurse practitioner or physician's assistant. And these healthcare practitioners can issue these orders in a MOLST form to carry out your wishes about life-sustaining treatments, such as CPR, ventilators, and feeding tubes, that sort of thing.
Jane, Paul just mentioned 5 wishes. There's so many kinds of advanced directives out there that people can find just by going on the internet. You hear 5 wishes a lot. What's the difference between 5 wishes and what's on the Attorney General's page?
Well, it basically provides you both it is an advance directive that provides you with your living will and your durable power of attorney for healthcare, which are the two parts of an advance directive that are needed. It's called the living will with a heart and soul because it talks to basically, common language, simple terms. My husband calls it touchy-feely. Some people like that, some people don't. But it doesn't have all the legal ease that a formal form like the state form has. So some people prefer it. There are, as you say, numerous tools out there that can be used. My goal in working with people is I don't care which tool they use. I care that they use something and get their advance directive done. The other tool that is very popular right now and fits in very nicely with what we've been doing in Maryland is My Directives. And My Directives is a tool that is not a piece of paper like the other two are. It is a digital opportunity to put down your preferences, your choices for care online, and is very, very useful for documenting your advance directive.
That's an online program?
Yes, it's an online program.
And how would people get to it?
Well, there's several different routes to get to it. In Montgomery County, we encourage people to go to Voice Your Choice, which is a program that is educating people about advance directives. And from Voice Your Choice, there's a little green button at the top right-hand corner that can be used by anybody, and that takes you right into mydirectives.com and will allow you to fill out your form there. But the good news is that if you aren't really thrilled with the idea of doing everything online electronically, and you have a 5 wishes or a Maryland form, you can also go into My Directives and upload any hard copy forms that you might have. And that will allow you to get your directive into the system that Maryland uses to store documents for the state.
Paul, there are requirements for advanced directives, and electronic seems to be different. What are the requirements if I write one out, and what are the requirements if I use an electronic system?
Sure. The requirements for an advance directive are pretty straightforward. They're pretty simple. They were deliberately made so people could not be intimidated by it and could actually do it on their own without an attorney if they wish. And that's certainly something we can all do. So the requirements are very straightforward. It has to be about healthcare decisions. So the document could include other things like financial matters, but to be an advance directive, it needs to be about healthcare decisions. Who makes them, or what decisions you want made for you. So who makes them is the healthcare agent that you appoint. So you have the opportunity with an advance directive, which is very nice, that you can choose someone you trust who you know loves you and will carry out what you want to be your healthcare agent and to talk to you, talk on your behalf. In fact, if you want, all you need to do is appoint the healthcare agent, and if you talk with them in great detail about what's important to you, what quality of life is important to you, that can be enough. But if you want to also make your wishes known very specifically and give instructions, these are what we often call living will instructions. So, for example, you may not want to be kept alive by way of a feeding tube. You could say, if I'm terminally ill, if I'm about to die soon, please do not keep me alive by a feeding tube, or don't keep me alive by other means of, artificial life support. It all depends on what you want and what's important to you. But in terms of the legal requirements, it's very straightforward. What you do is you sign the document in front of 2 witnesses. So these are 2 adults. Neither of the witnesses can be your healthcare agent. So anybody you appoint, it's always good to have backup agents too. Anybody who you appoint as a healthcare agent cannot be your witness as well. Also, only one of the people who are your witness who act as your witness may be benefiting potentially from your death, that is. So if they're likely to be named in your will, or if they're going to be a personal representative, it's probably best not to have them as a witness, though one of them could be that witness, but the other could not. So I just tell people, don't have your family members be your witnesses. You don't need a notary public in Maryland. Again, they tried to make it very simple in the Maryland legislature, so you don't need a notary public. Now, a notary could be one of your two witnesses if you wish. And the most important thing, though, is that you have a copy of the document with your healthcare agent, and that you can take it with you to a healthcare setting so you know where it is. Because if people don't know that it exists, it's not going to do you much good. So we also have wallet cards available on the Attorney General's website, or you can do them anywhere, but it's good to have that wallet card that says, I have an advance directive, I have a healthcare agent, you can get a hold of the healthcare agent at this number, and we assume too that you've given the healthcare agent a copy of your advance directive, and it's important to tell your healthcare agent, just as if you didn't have an advance directive, it would be important to tell your loved ones what you want, what would be important for you, what treatments you're willing to accept, and what you would prefer not to under certain circumstances. So the actual legal requirements are pretty straightforward. It's about healthcare decisions. You sign it, you have it witnessed by two eligible witnesses, and then you keep it in a place where you can find it easily, make sure the healthcare agent has a copy, and they can be contacted.
How do I do that if I use an electronic means?
Well, an electronic advance directive does have the advantage of having a place where your healthcare provider can access the website. Assuming that they have your healthcare provider has access, they can access to that, and so it cuts down on the challenge of finding a paper document. There are certain security concerns with electronic advance directives, so the law allows you to do an advance directive electronically, but if you don't want to have witnesses, and it's cumbersome to have witnesses for an electronic advance directive, you could theoretically have people with you as you're at the computer doing the form, and they could witness it there. But generally, people would be doing it on their own, and they can do that if they do things to authenticate their identity. So they need to meet certain standards. That is, the website needs to meet certain standards for authenticating identity. And these are set out in federal law. Now, one sure way to know that your electronic advance directive is valid is that if the website that you're using has been approved by the Maryland Health Care Commission, and it's because they've vetted whether they've met those requirements. My directives is one that has met the requirements, so you know that's for certain someone you can use. So I recommend people use that for now, and then watch out and see if Maryland Health Care Commission does approve anyone else, and they may. But even if they're not approved, if they do meet the standards for authenticating your identity, it'll be a valid advance directive. It's just you want to be sure if you're asked certain things you may normally feel a little uncomfortable giving up, like your part of your social security number perhaps, or a account number somewhere. They need those things to make sure it's actually you that is making this advance directive, because we don't have witnesses for this.
Alan, I understand you go around the state talking about advance directives and MOLST. Where do you go? Who do you teach? Tell us a little bit about that.
Yeah, quite a few years ago, I was one of, I think, maybe 13 people trained by a grant from the Maryland Office of Healthcare Quality to do training on advance directives and MOLST. And the idea was we had actually PowerPoint presentations for both consumers, people like me that don't have a medical training or background, but then also for healthcare practitioners. And the idea is to use simple terms, spread the word, and in a level of detail that's appropriate. So for consumers, people that don't have medical training, yes, it's providing certain information, and the things that Paul just talked about are some of the resources that would be included for a group of people. And I've done that at assisted living facilities, different care facilities. And I've also done training for healthcare professionals at Stella Maris, at hospitals, and and sometimes I do the training. It's only on advanced directives, uh, and then other times it will be advanced directives and MOLST. And as you know, you're getting some sense of course, the two are related, but on the other, they're related in their general purposes, but of course, they're very, very different. And so the idea is to spread the word and have more people think about, for advanced directives, think about what's important to them. And as Paul and the other people train me, have conversations. I mean, that's central. The thing that I've heard from time to time. Yeah, I completed an advanced directive. I named a healthcare agent, but I didn't tell them who they were, which is not the way to do it. The idea is to think carefully, to have discussions, and there may be people who would not be willing. If you lost the mental ability to say yes or no to healthcare, there may be friends, relatives, or whatever that if they were the ones who had to make decisions about keeping you alive, that and your wishes were, I don't want to be kept alive on a machine, they would say, oh no, I can't do that. And that would mean to me that that's not the person you want as your healthcare agent. You want the person who is able to make the best decisions they can on what you would want. So it's really it's so meaningful to me, and that I've done it, numerous times. Um, and of course, the irony is it's especially important now during COVID-19. And of course, there's no way to appear before groups of people. I was scheduled to do trainings at 14 Baltimore County senior centers during 2020, and I did several, but of course, after the pandemic, the senior centers are closed. The other thing is, as we were talking about MOLST, and the thing I emphasize when I do training about MOLST, once again, from my experiences and from learning from Paul and Trish Ney, who is the director of the Maryland Office of Healthcare Quality. MOLST is medical orders for life-sustaining treatment, and I've heard over and over in different contexts of MOLST being handed by a doctor to the patient, and the doctor says, just check off what you want on here and I'll sign it. And that is a violation of Maryland regulations. The healthcare provider, the doctor, the nurse practitioner, or the physician assistant is obligated under law, and it actually says it above the center line of the MOLST, to have a discussion. They have to have a discussion with the patient or the healthcare agent, but in simple terms, just the patient. The idea is for the person signing to have the discussion with the patient about, okay, here is what you are facing, here's what your conditions are, here's what you may be facing. And it goes everywhere from a perfectly healthy person to person who may be, dealing with end of life issues. And the idea is to have that discussion and a discussion back and forth, not the doctor or NP or PA telling the person, but listening and reflecting and then filling it out based upon what the person would want. And that's an emphasis for me.
Jane, give us a perspective from the other side, from the hospital and the doc. Why is it important for them to have the patient have an advanced directive or a MOLST form? And why is it important? What's the difference from from the hospital or the facility or the doc's point of view.
Yeah. It is extremely important for the healthcare professionals to work with patients as best they can to provide the kind of care that the patient truly wants. And if you're seeing a patient for the first time and you've never spoken to them before, you really don't know them well enough to make independent decisions as to what they would want. And that's the purpose of an advance directive, is to understand what it is that's important to a person, what matters most to them, and what it is that they would want in any kind of situation. It's obvious that we all can't sit here and think of all the situations that we might be faced with. So it's not a case of saying, I want this if this happens, or this if that happens, because that doesn't work. What you need to understand is what really makes that person tick, and what matters most to them, and what their preferences are, and their personal quirks and strengths and weaknesses and joys and hopes. All those things are important. The healthcare team wants to know what the patient would have wanted, and so that they can make good decisions. Now, when the patient comes into an emergency room, there is no one who is going to sit down and spend any time at all reading through an advance directive. Okay, and everybody says, well, why is that? And I said, you don't have time if someone's coming into an emergency room. The person is coming to the emergency because they have an emergency and they need something now. And trying to figure out and read all those pages makes no sense. So when you come into the emergency room, you come in for care. And so the MOLST gives you a way of communicating your preferences very quickly and easily to the healthcare team that comes in. In fact, it's to the EMTs who picked you up at your home. You'll find that EMTs will go, when they go to a home, they go to one of two places, or they go to two places, because there will be two EMTs arriving in almost all of the situations out there. And one will go and see the patient, and the other one will be going to the refrigerator. Now, why the refrigerator? I have a client who I talked to, and she asked me the question. She said, I don't understand. Two guys came in. They wanted to talk. They wanted to see my husband because we'd called for him. One of them went to see him. The other one went to the refrigerator. Do you think he was hungry? He was hungry. Well, no, he's not hungry. He knows that that's where people have been told to put the important documentation about their health care is on the refrigerator. So if there's a MOLST on the refrigerator and it says do not transport, it says no CPR, it's stuff like that, the EMTs it will be then, that is a doctor's order or a healthcare professional's order, a medical order, and that order gives them the freedom to do what needs to be done for that patient right then, and perhaps not transport them if that's what the order is for, so that they know that they're doing the right thing for the patient and they have been given the order from a healthcare professional. So it's extremely important. The problem is we sometimes put the cart before the horse, like Alan mentioned. Everyone age 18 and above should have an advance directive. It is extremely important that everyone have that advance directive and have thought through what's important to them, what matters most, and had conversations with their loved ones if they can get their loved ones to have the conversation. But even if they can't, they should have identified who their healthcare agent would be, who would speak for them, have that conversation with them, make sure that healthcare agent is ready, willing, and able to do this. I always tell my senior citizen groups, if your healthcare agent is someone who is in the hospital more often than you are, it's probably not the best choice. You need someone who is going to be able to help you and be there when they are needed. So if you already have an advance directive, it makes it so much easier to make that next step when a MOLST is necessary to allow the physician to read your advance directive And that will begin the conversation that needs to be had in order for him to write your orders for your MOLST. So they come one after the other in terms of precedent order, and everyone needs an advance directive, and only certain people need a MOLST. If anyone tells you that everybody in the state needs a MOLST, tell them they are wrong, because you don't need a MOLST if you don't have a need for it. And so advance directive first and then the MOLST. And in the hospital, if you've got the MOLST that came in with you, it's going to give a beginning to give some guidance to the healthcare team that's there. But having the advance directive follow when the patient is out of extremis and through the emergency phase and needs to be reevaluated is when an advance directive will come into bear, and people can use that and use that.
Time goes so fast when you're having fun. 30 minutes. So I'll give each one of you like 30 or 60 minutes to make a final statement. Jane, why don't you start? Somebody's phone is ringing. I don't know.
That's mine. I'm sorry.
Okay.
Again, my name is Jane Markley. I run Jane Markley Consulting and Jane Markley Consulting is an advanced care planning company that I started 10 years ago to help people develop their advanced directives. I facilitate people's discussions about advanced care planning. I facilitate conversations with their loved ones. And I also educate the public and also healthcare personnel so they better understand what to do when they do get an advanced directive so that they can be read and utilized effectively.
Alan?
Yes. I'm a retired Maryland Assistant Attorney General, which is how I met Paul Ballard. And since I retired in 2010, I've been focused on healthcare and healthcare law. And I was trained to do training on advanced directives back in 2013. And it really engages me because when I was young, it was, the norm. I'm 72 years old. The norm was you do what your doctor tells you to do. And that shouldn't be the way it is. It should be centered on the decisions of the patient, and if they don't have the ability, someone else. And then I'm also the chair of the State Advisory Council on Quality Care at the End of Life.
And finally, but not least, Paul Ballard.
Thank you, Ted. Yeah, I think it's really important for people to think ahead. That's really what this is about. We all don't live forever, unfortunately, and we get sick, and we end up dying. And the question for us is, do we know what kind of quality of life is acceptable for us? And because we don't always have to take every treatment that's offered. Now, the healthcare people are wonderful. They have all kinds of great medicine and treatments, and they'll keep you alive as long as they can possibly do it. But sometimes people just think, well, that's really not the quality of life I would want. And if that's you, if you're looking at people on machines and you're thinking, I'm not sure I really want to live that quality of life, then think about what quality of life is acceptable to you. And if there's a quality of life that's not acceptable to you, talk to your provider about that. Get a clear idea of what does that treatment mean? What does it mean to be on that feeding tube? What does it mean to get CPR in my condition? What does it mean to be on a ventilator? And that's certainly a critical thing right now with COVID. What does it mean to be on a ventilator? Have this discussion with your provider. And then when you're educated about what that means, then it's really important to have that discussion with your loved one. Because when you're out of it, they're the one that's going to have to make those decisions. So they really need to know what's important to you. Because Jane's right. You're not going to be able to anticipate every possible thing that can happen to you. You're just not. But you can tell your loved one, okay, look, it's really important to me to be able to communicate, to speak with my loved ones, let's say, to have a conversation with someone. If I can't, I really don't want to go on. Something like that. It's things think about what's really important for you. It may be important for you to be kept alive every last second on machines. That's fine too. But it's really vital. Just a personal statement about my family life. When I've had, a relative die, it was really important knowing their advance directive, knowing more than the exact. I'm not even sure I saw the exact advance directive, but I knew what the person wanted from what their conversation with them. And so everyone knew what they wanted, what was important to them. So there wasn't a feeling of, oh, we really should be doing this instead of that. No, we knew what they wanted. And it wasn't something I would have done. It wouldn't have been my value choice, but that wasn't the point. The point was we were carrying out what they wanted. That's really what the laws are about, trying to carry out what you want. And the only way the laws can really help you is if you think about them now. Think about what you want now and make advanced preparations.
What a wonderful summary. Thank you all very much, and bye for now.
Bye.
Thank you very much.